So in this video we'll see about the carving of maxillary canine. So first and foremost step what we should do in before starting the carving is we should mark the surfaces and we should draw the midlines. So here I marked the surface. This is the labial surface, mesial surface, palatal surface and distal surface. So on the labial surface I already drew the midline. And next step is we should mark the 3/1/3 of the crown. So this is the cervical 1/3, middle 1/3 and incisal 1/3. So two lines you have to draw and divide the crown part into 3/1/3. And before marking these 1/3 you should mark the length of the crown. So in the case of maxillary canine the length of the crown is 10 millimeters. So first you should mark the length of the crown with the help of scale and divider. You should measure and mark and extend this dimension. So this 10 millimeters dimension you have to mark on all the surfaces, and on the labial side you should mark 3/1/3, and then we should mark in the next step we should mark the mesodistal dimensions of maxillary canine. So mesodistal dimensions of maxillary canine are 7.5 mm at the crown and 5.5 mm at the cervix. So I already marked the dimensions. Same this till this step it is common till the trapezoidal step it is common for all the teeth. Same, it is similar to the incisors. So same thing we should mark the dimension even on the lingual or palatal side. And joining these 2 points we should draw the line. So then same thing, on the palatal side also mark the 3/1/3. So next step what we should do is we should remove excess wax what is there outside this line, same like how we do for the incisors. So now we got a trapezoid like structure, and next step what we should do is go to the mesial or distal sides and mark the labiolingual dimensions. So for the labiolingual dimensions of maxillary canine are 8 and 7 mm. So with the help of divider again mark 8 and 7 mm. Same thing you repeat on the other proximal surface, and again draw a line joining these 2 points. and remove the wax what is there outside these lines. So now we got a trapezoid like structure. And before moving on to the next step, just make sure all the dimensions are fine. Just check all the dimensions once, all the mesodistal and labiolingual dimensions. If they are excess, just reduce the dimensions. So in this step, now come to the labial aspect. This is a labial side, and next step what we should do is mark the midline in a very faint manner and mark the 3/1/3. So now we'll start carving the labial surface. So now we'll mark the mesial and distal contact areas. So this is the labial aspect. So the mesial contact area is at the junction of incisal and middle 1/3. So here, and the distal contact area is at the center of middle 1/3, and this is the center of the cusp tip. So in the midline. So you should draw a line from both the mesial and distal contact areas towards the midline to mark the cuspal slopes of the canine. So these are the two cuspal slopes. And same thing you can do it on the palatal side also. Mark the cuspal slopes. Mesial cuspal slope will be shorter and distal cuspal slope will be longer. So cut it off. Whatever wax is there outside this line, you can cut it off. So through and through towards a lingual side you can cut it off. So now we got, so the now labial aspect of the canine is almost ready. So we mark the mesial contact area at the junction of middle and incisal 1/3 and distal contact area at the junction at the middle of the middle 1/3. Distal slope should be longer, mesial slope should be shorter. So now after this we should go to the proximal aspects. So if you observe, this is the crown mesial aspect of the maxillary canine. So this cusp tip, this tip is called as cusp tip. So the cusp tip is almost at the it coincides with the line bisecting the root, or slightly 1 mm labial to the line bisecting the root. So it should not be, the cusp tip should be, it can be either labial or exactly in the midline, but not towards the lingual side. So for that what we should do is, and one more thing what you have to remember is the crest of labial crest of contour and the lingual crest of contour both are in the cervical 1/3. So now we'll go to the distal aspect here. So on the distal aspect, this will be the labial outline, this is the lingual outline. So above the cervical 1/3 you should start sloping towards the midline. So on the labial aspect we are carving now. Above the cervical 1/3 you are trying to move the cusp tip towards the midline. And remember, you should leave the elevation in the central part, which is the future labial ridge. So here you can see the labial ridge here. In the center you will have a prominent labial ridge for the canine. So a ridge is nothing but a linear elevation. So the linear elevation which is present in the midline of the labial aspect is the labial ridge. So on the center you should remove the wax less, and on the either sides you should remove the wax more, so that the center becomes the prominent area. And similarly on the lingual side also, you have prominent cingulum in the cervical 1/3. So above the cervical 1/3 you should remove the wax and try to converge towards the midline. So you should create the labial ridge on the sorry, on the center of the labial side. So on either sides you can slope it so that the central labial ridge becomes prominent. So you can see the labial ridge here. This is a labial ridge. So prominent central labial ridge, and on either side you should remove the wax so that the center becomes prominent. So after doing this, we will go to the lingual aspect. So in the lingual aspect you can see the lingual fossa, and this is the cingulum, and this is a lingual fossa. There are two lingual fossae for the canine, and this is the central lingual ridge. So you should draw a triangle shaped areas on the lingual side, two triangle shaped areas on the lingual side, leaving the central lingual ridge to be prominent. So we will go to the palatal side for the maxillary canine, or the lingual side. Now we will draw two triangle areas leaving the central lingual ridge. So I drew two triangular areas here, and scoop out the wax within the triangular shaped areas. You can use both the sides of the carver for removing the fossas, whichever you are comfortable with. So I created two lingual fossa here, leaving the central lingual ridge. And then we should do the lingual convergence. So the mesodistal dimension on the lingual aspect is less compared to the labial side, so we should do the lingual convergence. And so you can see the concavity here. This is the mesial aspect. So there is a concavity above the cervical 1/3. So in the middle part of the middle 1/3 on the mesial aspect you can see a concavity. So you can create that concavity now. So this is the mesial aspect here. So slightly I am removing wax in the middle 1/3 so that we will get the concavity. And cingulum becomes prominent. Cingulum for maxillary canine, cingulum is very much prominent. So cingulum should be very prominent for maxillary canine. So when you make this concavity, obviously the cingulum also becomes more prominent. And refine the fossas again, because we try to create the concavity, so this fossa will be slightly they will become shallow, so just refine it again. So there is a prominent lingual ridge in the center. There are two lingual fossae. I'm just refining the fossa a little bit so that it appears triangular in shape. So this completes the crown carving of the maxillary canine. I am just refining the cuspal slopes. So the distal cuspal slope should be longer, and distal contact area should be in the center of the middle 1/3. Just refining the labial ridge. I'm just polishing it a little. So this completes a canine crown carving. I'll just, before going on to the root, I'll just show you all the parts of the canine. So this is a labial aspect. You can see the prominent labial ridge in the center. So these are the two cuspal slopes. So this is the distal cuspal slope, which is longer, and mesial cuspal slope, which is shorter. And this is a lingual aspect. You can see the two lingual fossa here. Two triangle shaped lingual fossa and the prominent central lingual ridge, and this is a cingulum in the cervical 1/3. So this is a proximal view. From the proximal aspect you can see, so this is the midline, so the cusp tip is coinciding with the midline. It is not going either lingual, or it can be slightly labial, but it should not be lingual to the midline. So this is a cusp tip, and you can see the labial and lingual crest of contours, which are in the cervical 1/3. So above the cervical 1/3, both the areas are converging towards the midline. So this is a mesial aspect, and same thing on the distal aspect as well. So this is the crown carving. So root is it is a single rooted teeth. So the length of the root for maxillary canine is 17 mm. So mark the 17 mm dimension. So this is the root dimension. So length of the root of canine, maxillary canine, is very long. So mark the 17 mm dimension on all the surface, all the sides. And then root is conical in shape for maxillary canine. So draw a rough conical shape here. And remove the wax which is outside these lines. And same thing you do on the proximal aspects as well. And always the margins of the crown on root should be rounded. You should not do sharp margins either for crown or root. So reduce the wax till you reach the dimension of the crown. So root and crown should not be separated, both should be continuous. Outline of the root and outline of the crown should be continuous. And root also should have the lingual convergence. So I'll just polish the crown and root once and we'll draw the cervical line. this completes the canine carving. So you can see the root of the canine. So once we are done with the polishing and carving of the canine, then in the final step we can draw the cervical line, which is semicircular or U-shaped outline so the curvature of cervical line on the mesial side is 2.5 and distal side it is 1.5. So distal mesial side, the cervical line is more concave. Distal side it is less concave. So this completes the carving of maxillary canine. You can see the root, crown.